This might sound familiar. You went out to have dinner, you had the first few amazing courses, and you had some drinks. And at some point, you needed to pee. You walk to the public restroom and you find that they have 3 urinals. You pick the middle one. And right at the point where you wanted to pee, 2 other guys walked in and they started to use the urinals next to you. And at that specific moment, you couldn't pee anymore. Shy Bladder Syndrome kicked in. Now, it left you awkwardly standing there waiting for the other guys to finish peeing. And right at the moment when they did finish and they leave the public restroom, you were able again to pee. Your peeing problems were resolved. Now, you're not alone. This is a very common social phobia and it's the topic of today's video. We will explain what it is, what symptoms it can cause, and most importantly, how you could potentially fix it. And those of you meeting for the first time, my name is Raoul, I'm a medical doctor from the Netherlands and it's my mission to medically educate you, my viewer. Because educated people make healthier decisions, which is the whole point of this channel. So make sure to watch the whole video so you don't miss any important information, and let's get started. Now before I can explain where these difficulties peeing come from, it's important to recap your urinary system. So the urinary tract includes your kidneys, which are 2 bean-shaped organs which produce urine by filtering waste from your blood. Your bladder, which holds your pee until you need to urinate. Your ureters, which are 2 thin tubes that connect your kidneys and your bladder. And your urethra, the tube through which you pee, which goes from your bladder to the outside of your body. In essence, the trigger to pee or to urinate comes from the bladder itself. When it fills with urine, it expands and expands, and therefore it triggers certain nerve endings surrounding the bladder. These nerve endings go all the way to your brain, and it signals to your brain that you need to pee. And if you would then go to the bathroom to urinate at such a moment, the bladder wall will contract, and the sphincters in your bladder and urethra will relax. Just to explain, a sphincter is a medical term for a ring-like muscle. It's located, for example, in the end of your bladder or your urethra, and when it contracts, it would block the flow of urine. This is simply explained how peeing works. However, it doesn't always work properly. For example, when you're dealing with Shy Bladder Syndrome. In Shy Bladder Syndrome, people find it impossible or almost impossible to pee at unfamiliar places or when other people are around. Other terms for this condition are paruresis, bashful bladder syndrome, or pee phobia. As mentioned, this is a type of social phobia. People with this condition are physically able to pee, but their anxiety prevents them from being able to do so at certain locations or situations. This often includes public restrooms or somebody else's bathroom, and when dealing with Shy Bladder Syndrome, this causes a lot of stress. And stress leads to increased muscle tension. Increased tension in the previously mentioned sphincters. Sphincters in the bladder and the urethra, and these block the flow of urine. The severity of Shy Bladder Syndrome can be classified as mild, moderate or severe. In mild cases it might happen on occasional events, much like a form of performance anxiety. This is very similar to the example I mentioned in the intro. You go to the public restroom and when you're flanked with other people, for example in the urinals, you're not able to pee. However, in severe cases, someone may need complete privacy when going to the toilet, may only be able to pee at home, may not be able to pee when guests are present, may feel anxious about needing to urinate, may restrict drinking to reduce the need to pee, may avoid certain social events or traveling, and may criticize him or herself for not being able to pee. Now I hope you're finding this video helpful, and before we continue with some useful tips and tricks and treatment options, I want to ask you to click the like and subscribe button. This would help out the channel tremendously and it's free, and in return you will get a notification each week with a new awesome medical video. Thank you, and let's continue. As you might imagine, severe cases of Shy Bladder Syndrome can hugely impact someone's life. It can lead to social isolation and it can deteriorate someone's personal and occupational functioning. To make matters even worse, patients might often feel ashamed to talk about it. And in certain cultures there might be a stigma which further increases the difficulty of this problem. However, there are certain treatment options which can actually help. This is what makes it also important to contact your doctor. He or she could help you to find out the extent of your symptoms and find out the underlying problem, so treatment can be started. Your doctor might do this by asking about your medical history, your current problems and your symptoms, the medication you're using, and afterwards your doctor might do a physical examination, some blood tests and urinary tests. Furthermore, if needed, your doctor could also refer you to a psychologist or a urologist, depending on the underlying problems and causes. So let's say your doctor indeed finds you're dealing with Shy Bladder Syndrome. Then your doctor can provide you some useful tips and tricks which you could implement to increase your quality of life and decrease your symptoms. It all starts with a healthy base level. If you're in the best shape possible, physically as well as mentally, this will help you to cope with everything life throws at you. Therefore, your doctor might recommend that you stop smoking, limit your alcohol consumption, exercise at least 150 minutes each week, consume a balanced diet consisting out of low levels of saturated fats, salts and sugars, eat plenty of fibers, fruits and vegetables, maintain a healthy weight and have a structured sleeping schedule. Sleep about 7 to 9 hours each night and decrease your stress. You could do this by maintaining social contact, doing fun activities and relaxing. In addition, your doctor could also share some specific tips for dealing with Shy Bladder Syndrome. First of all, your doctor might recommend you to make a list, ranking the easiest places for you to urinate all the way up to the hardest ones. You see, one of the most important things to do is to keep practicing. The idea here is to start peeing at the easiest locations and work your way up. It's best to do this with a peeing partner, someone you know very well, a family member or a friend, someone which can help you practice. First of all, drink a lot of water so your bladder is full. Then go to your home toilet and ask your peeing partner to stand as close to your home toilet as you feel comfortable while you try to pee. Urinate for a few seconds and then stop a few minutes. Afterwards, repeat this process, but now let your peeing partner stand a little bit closer each time. This may take several sessions. It often is awkward but helps way more if you make as much noise as possible, so make sure to splash the pee while peeing. The next step is to practice this process with your peeing partner in a quiet public restroom and ultimately work your way up to a noisy public toilet. Furthermore, your doctor might also advise to meditate or to do breathing exercises. This might decrease your stress levels and anxiety and relaxes your muscles. So the sphincters could also be relaxed, which makes you more able to pee. Lastly, it's very important to avoid negative self-talk and take it slowly. It usually takes about 12 sessions. After those, you hopefully can see good results. And remember, you're not the only one dealing with Shy Bladder Syndrome. Unfortunately, it's very common. Unfortunately, in some situations, these tips aren't enough, even if you really tried. And then you need a little help. At this point, it's important you visit your doctor again and really discuss possible treatment options. And luckily, there are many. To keep this video short and sweet, I will only mention the most common and most effective forms of therapy. First of all, cognitive behavioral therapy. This treatment can help you to change your behavior by changing the way you think and behave. Another effective treatment option is graded exposure therapy. Here a therapist helps you to start peeing and be comfortable peeing in a controlled environment. Over several sessions a week, you gradually increase your exposure to more and more difficult urination locations. Exactly as I explained you could practice with your peeing partner, only instead of a friend or a loved one, you now will be practicing with a therapist. Other useful treatment options could be hypnotherapy and psychotherapy. In addition, your doctor might also recommend certain medication, which might lower your anxiety complaints. Lastly, sometimes your doctor can also recommend self-catheterization, which is a tube that you can enter through your urethra to the bladder to empty the bladder. This could be helpful when you're away from home, but it's not a permanent solution. It can enable you though to keep living the life you want to live. Now I hope you know more now about Shy Bladder Syndrome. If you have any questions, let me know in the comment section and I will do my best to answer each and every one of them. For those of you that want to keep on learning, check out the playlist in the description with more awesome medical videos. If you did learn something, please click the like and subscribe button. It will help out the channel tremendously and consider subscribing. I want to give a special thanks to my Patreon supporters. Thank you, Sebastian, who is an Investor T supporter. And if you can't get enough, check out the Instagram as well, @HowToMedicate. I will see you next week with a new video. Bye bye.